Good evening, everyone, and welcome. We're glad you could join us tonight, and I believe that you will find this a very worthwhile event. With our hosts, we're excited to have you engage with our panelists and hope you'll feel comfortable asking them questions and getting the information that you really need from this group. Please also take time to look over the resources outside the room. For the library, we have not only books, but we also have available our memory care kits, which are specifically designed for those dealing with dementia or memory loss, and for those that work with them, if you're a family member of someone, and all of those resources you can check out from the library here. In addition, I have to say that this is an interesting space. It's a very unique library. Oh, maybe there I am. In all of the state of Idaho, we hear people tell us that all the time when they come in our doors. But we do have to recognize that the land, this location that we are upon, is the homeland of the Nimipu, and we want to recognize that. We ask that those of you in attendance reflect on this land that we're situated, their tribal sovereignty, and the trauma inflicted through loss of place, space, knowledge, and identity. Learn today. We consider how we can actively support and all peoples in our area, whether it comes to caregiving, whether it comes to aging, whether it comes to working with those with disability. I appreciate you attending today, and I hope this is a well worth time program. I believe it will be. As someone who is also a caregiver of a spouse, I completely can relate with you, and I was happy to jump on this idea when it came to me. So thank you.
Lynn, can everyone hear me? All right, we'll try this. That good? Okay. All right, thank you everyone for coming. My name is Rachel Sun. I'm a reporter at Northwest Public Broadcasting and the Lewiston Tribune. Thank you for joining us for tonight's screening of Caregiving. There's a survey for you to do at the end of the event, and your input is very important and can assist us in future grant funding and events, so please do that. With that, we'll get started. So, everyone has a care story. Caring for our families is the most important and invisible work that we will ever do. That's a quote by Ai-jen Poo from the film Caregiving. Thank you so much for joining us. NWPB is your local public TV and radio station. We work to bring educational, diverse, and enlightening stories into local communities to enrich and enlighten you and your families, to spread empathy and understanding. You, our audience, are the reason we exist. Special thanks to all of our friends and member donors here tonight, to our partners, the Lewiston City Library, and to tonight's guest speakers and the organizations providing resources, and NWPB's and the library's staff who help make this event possible. If you value programs like these, NWPB encourages you to visit our website or protectmypublicmedia.org to find out how you can contact Congress to urge them to protect public media funding. Located on the sign, and to be sure to take an event survey after the discussion located on the sign-in table. This provides us valuable feedback to support future programs. We hope you'll come away from tonight's event with greater understanding of both the state and states of care in America, as well as greater knowledge of local resources and professionals and advocates based here in our community. Executive produced by Bradley Cooper, the full 2-hour documentary, Caregiving, will premiere on PBS stations nationwide next month. You can also find the film on the NWPB Passport or on the PBS app. And now, here's a 30-minute preview of the film. All right, we're going to move to the panel discussion portion of our event tonight. This will be 30 minutes. After that, you, as the audience, will have the opportunity to ask questions to our panelists as well. And before we get started, I'll remind you again to please take the survey. That helps us make sure that we do these as well as possible for the future. So if the panelists want to go ahead and come up here, I can introduce them. So Anissa McFarland is a registered nurse and director of hospice with Elite Home Health and Hospice in Clarkston. She's also brought along Kyle Ambrose. Kyle, if you could raise your hand for the people in the room. Kyle will be able to help answer questions specific to senior care. So if you want to find him after this, he's your guy. We also have Mark Havens. Mark is the executive director of Interlink, which provides transportation and home accessibility improvements for homes for disabled individuals and seniors. Finally, we have Todd Holcomb. Todd is the director for the Area Agency on Aging. Thank you all for coming tonight. I wanted to just start off with, as we just saw in this clip of the film, there are so many people who are caring for a loved one in their family, often with very little support. What are some of the resources that are available to them, and how can they manage that burden when, maybe they're just on their own, or maybe it's just them and another family member? And whichever one of you would like to start.
Hello. We'll see if we can keep this microphone working. If not, I'll just start shouting at you. Like she said, my name is Todd Holcomb. I am the director of the Area Agency on Aging, housed here at the Community Action Partnership, just around the corner, really. My agency operates by funneling Older Americans Act money into the community. And so what we try to do is support work that's already happening. So we will partner with local caregivers to provide caregiving support in the form of homemaker services, like general chores, light work around the house or yard, and respite care, which is a service for the caregiver themselves when they need a break or maybe they need to run errands. So we partner with local agencies that provide that service. We pay the bill for that and then help maintain it. We also have a consumer direct option where somebody can actually pay a loved one or a friend or somebody they trust to do those kind of services, to sit in and maybe be a respite provider or come in and provide homemaker services, and then we can reimburse them directly. So we have these kind of options along with many other services meant to help our seniors age at home and in a healthy way. We partner with meal sites to help get food delivered to homes or provide community meals. So these are some of the things that if you were looking for these kind of supports, you could call our office and find out how we can connect you to these services.
Is that better? So we provide home health and hospice, and it's a Medicare-funded program. So we don't provide the caregiving part of it, but we can definitely supplement through Medicare. If you qualify for home health or hospice, that also includes a home health aide that would come in and provide personal care assistance. And it's not like hourly care. They would come in and do the visit and provide the services that the nurse ordered. And so.
Good evening, I'm Mark Havens from Interlink, and Interlink has been here in the Valley for over 40 years. We're not part of a national organization. It's a local homegrown organization. Obviously, every family is different. Every person's different for what their needs might be, and we up here, we're explaining what we can do. Interlink, currently, our programs are home safety modifications. Now that's modifying the home in ways that make it safer for the person living in it. That could be anything as small as grab bars in the bathroom or bedroom, or handrails inside the house or on the porch outside the house, up to wheelchair ramps, or technically they're called access ramps. Most of our clients who have the ramps actually are not in wheelchairs. They have walkers and they just can't manage going up and down staircases. Sometimes temporarily, because they've had surgery or they're going through rehabilitation, sometimes permanently for the rest of their life. And then we also provide transportation. When I say we, I mean our volunteers. We're a volunteer-run organization, and our volunteers will drive clients to appointments, usually medical appointments, but also grocery stores, beauty parlors, barbershops, lawyer, dentist, for people who no longer drive, or maybe you do drive, but you can't drive to that appointment. Cataract surgery, colonoscopy, things that they ask that you not drive, and these clients have no one else to turn to. They don't have family, perhaps they don't have friends, and so we exist for them. But it's clear from that clip from the video that there's a lot more needs than just what the three of us up here have described, and there are more services in the community.
Mark, I think that's can you hear me still? I think that's a great segue to the next thing I wanted to ask you about, which is the state of the caregiving industry. You saw and touched on here that a lot of the times caregivers struggle with low pay and a lack of professional recognition at times. I'm wondering what you all feel needs to be done for that industry to not only survive and meet the needs of the growing elder population, but thrive.
You're looking at me. Get the live mic. Yes, I have the mic that can't be shut off. Once it's on, it's on. We live in an interesting community in that we straddle a river, and so we're in two different states. I think I would point out that the state of Washington leads the nation in having paid family medical leave once you've signed up for the program, as well as something launched recently, and the CARES Act, I can't remember the exact title, but it will start in a few years being able to pay for long-term care expenses, provided you've been paying into it. So it's an insurance program along that line. So that's likely to help if the workers are there to be hired. And that's the big problem, which was touched on at the beginning of this clip of the documentary we watched, is just the shortage of workers. Where are they going to come from? As we have a growing elderly population, not to mention disabled, people of all ages and disabilities, where are the workers going to come from? Is it strictly a question of money? Or do we have to consider more creative solutions? I don't have a magic answer for that.
I would say, so our Walla Walla Community College and LCSC have CNA programs that I think it's a 6 or 8 week course, but I know that they have a hard time filling up the class or curriculum, and so a lot of times they'll be canceled. I don't know what the answer is either, but our schools are definitely trying to help promote that and do education.
I think I would have to come alongside both of these answers and in a way agree there with Mark. I think one of the main answers is more money, better pay for caregivers. In my office, when I took over the director position, we were reimbursing caregiving contractors, I think at $22 an hour. And surprisingly, it was difficult to get people enlisted. And so we did a cost analysis to find out what the going rate was. And really, in the Lewiston area, the going rate for caregiving services from our contract partners was somewhere between $30 and $35 an hour. Across the river in Washington, it was $45. So 22 just wasn't profitable. And so I asked, I said, well, I'm just the director of this program. I'm not a caregiver. I don't run a caregiving company. How does this work? Tell me what it's like on your side of the industry and what you actually need from us. And I was told, I believe by a representative from ANS, who said, well, it's about 50%. Whatever we can charge hourly, we can give maybe 50% to our employee, and then the rest has to be insurance and overhead and coverage. And I said, well, here I am trying to see if you'll pay people, and I'm giving you $22 an hour. That means you can only pay somebody $11 an hour. And he said, yeah, that's why I don't have any workers. Okay. So we raised our rates to 30, which is the bottom, right? We knew that, but we're the highest district in the state of Idaho with that caregiving rate, and it's still just getting people by. And with our funding, we don't pay travel reimbursement, mileage, so the companies have to take care of that themselves. So to me, that would be the answer, is it just needs to be funded. It needs to be a career where a student can get into it and say, this is good work that I can be rewarded for, that I can grow into and build a career on and make money on and take care of my family with. That's what I think it needs to be.
Thank you, Todd. And, on the note of funding, I think that a concern for many people in the Valley, especially seniors, has been federal funding and, what's happening to that. How does federal funding affect caregivers, whether they're people caring for their families or professionals? And what will happen if we lose federal funding for home and community-based caregiving services? And is there anything that can be done about that?
Wow, that's not a light topic at all. For our area agency on aging, we are absolutely holding our breath along with everybody else to see how federal funding works itself out. We just had a meeting in Boise, and the hot topic was what we know we don't know. That's really, in all honesty, that's the way the condition it is I don't know people who have answers yet. We're waiting to see what happens at Capitol Hill. We're waiting to see what decisions are made, what passes, what doesn't. We are expecting a shift in the landscape. We just don't know what it's going to be yet. We'll have to get creative, and we'll have to get creative together.
I am certainly not an expert on this subject, and even less so about in-home care. I'm going to address it from kind of the top down. I worked for a few years in a care facility here in town, and one misconception people have is, well, Medicare pays those expenses. Medicare does not pay those expenses. They certainly don't pay the expenses for institutionalized facility care unless you're in for rehabilitation. So Medicare will pay for rehabilitation, but only up to 100 days. So what pays if you can't afford to move into assisted living or a skilled nursing facility, a nursing home? Medicaid. If you qualify for Medicaid, but not everywhere. Here's the shock. Medicaid, state Medicaid programs are not required to pay for those services. For assisted living, nursing homes, yes, but assisted living, no. I was really surprised to find out that the organization that owned the care facility here in Lewiston that I worked for, and it was the only facility they owned in Idaho. Mainly they owned facilities in the South. And they said, no southern state does Medicaid pay for assisted living? None. From Texas to the Carolinas, none. Your facility in Idaho is the only one where we have to deal with Medicaid. And I said, well, how do people live? They have to wait till they get sick enough to move into a nursing home, or the family has to care for them. So in that regard, we're lucky that Medicaid in Idaho and Washington is paying for care in a facility.
All right, you can. Something else I wanted to ask you about, and Mark, you've brought this up other times that I talked to you, was the role of, community programs to help seniors stay active and healthy longer, in addition to just trying to bolster the caregiving resources that are available. I was hoping that you could talk some about that and what kinds of programs are available and what might be good to see more of.
Interlink for the last 3 years has been working on a population project, which became an aging project, and now it's become a senior health initiative project. The smart people who attended those quarterly meetings came to the conclusion that with the growing number of senior citizens aging into that age group in the Valley, living longer than ever before, and then hundreds every year moving in to the Valley, we're not going to be able to grow our way out of this. We have to strive to help senior citizens and convince them to work on their own health and to have as many people as possible stay as healthy as possible, as long as possible, so that the future generation, which is pretty much now, and the next 20 to 30 years, use fewer health services than what has traditionally been consumed, because the Lewiston-Clarkson Valley is not going to be able to keep up and maintain that level of services, whether it's workers, beds in facilities, in hospitals, doctors, specialists. So we really want to help and convince senior citizens to work on their physical health, mental health, good nutrition, safe environments, falls, try to prevent falls, which are extremely risky and extremely damaging to the health of our seniors. It seems to be the only way that here in the Valley we'll be able to keep demand for services under control, is to focus on reducing the demand as opposed to trying to meet the supply of need.
Did either of you want to add to that?
I would say our home health program, which is funded by Medicare, is meant to be a short-term rehabilitation program. So our clinicians go to the home to help patients that maybe just had a surgery or just were in the hospital to rehabilitate and get to at least their prior level of function before they were hospitalized or had surgery. And so our nurses can do a lot of teaching with medications, with diet, about disease process. And so we can educate patients, and then our physical therapists and occupational therapists and speech therapists can do the rehabilitation physically.
I think it was already on. If you haven't heard of it before, there's a program called Fit and Fall Proof run by Idaho Public Health, and we help support that and get them to help them to grow and expand their classes. But that is one that's actively attended and involved, and it's great because it's physical exercise, stretching, flexibility, maintaining health, and learning how to prevent falls in the home. One of the best parts is when somebody can come by a house and help perhaps rearrange furniture, look out for extension cords, and otherwise, hey, where's your favorite spot to sit, and what's a clean line to the bathroom and the kitchen? And like, let's not have any accidents between here and there. Because Mark's absolutely right. Falls is, I think, the #1 cause of death. And it can get, some of the stories around falls is where it gets scary and lonely and terrifying to think about falling and being alone and not having help. So yeah, fit and fall proof and some other health related classes like that are important to get a hold of. And yes, you can call us and get info.
You know, one of the things I keep hearing from everyone that I talk about this issue with is that people rarely plan for end-of-life care. They rarely plan for aging until it's already happening. I was hoping that all of you could speak about the value that you can get from planning ahead and what it looks like when you do plan, and also when you don't plan and you wait until it's already happening.
Our social workers provide goals of care, conversations with patients, and talk about what their goal is as they age and kind of their long and short-term goals. And they help fill out paperwork and things to help them prepare for end of life.
Thank you for that question, Rachel. I cannot emphasize enough the importance of planning ahead, and it doesn't have to be morbid or even sad. So when I worked in a care facility, sort of like when Rosalind Carter gave the 4 different categories, we always had a saying that there were 2 categories. There were 2 kinds of families who came to investigate our facilities. The families that planned ahead and the families in crisis. You could tell in 5 seconds which category they fell into. There really are only those 2. The ones who come and ask to tour your facility because we don't need you right now. We just want to see inside every facility in the valley to see what looks nice, what we might want to move into. And then the ones who never imagined that their spouse or their parent would have a stroke, can't come home. Hospital's going to release them in a day or 2 and they have to go somewhere. What do we do? How do we pay for it? What do we do? How do we pay for it? Planning ahead is an act of love to your family members so they don't have to stress over it. It gives you peace of mind. And anything could happen to any of us. Start to consider your options and see what's available in your community.
One of the hardest things we hear is, I planned for retirement, but I didn't plan to get sick. Yeah, you've heard that one. Yeah, we were running a kind of a campaign in partnership with St. Mary's and Clearwater Health, as well as a conference that we put on in partnership with Interlink and some others, focused exactly on that advanced planning. The kind of running theme was, for St. Mary's and Clearwater Health, they were doing a series of classes each Wednesday night in October up on the Camas Prairie in Grangeville. And their theme was, get your ducks in a row. And in a similar way, we did a one-day event down here on May 3rd, and it was about advanced planning. And we presented the 5 Wishes booklet, which guides you through end-of-life planning and helps you write out your decisions, what kind of care I want, get your legal stuff in order, and then have that conversation with your family while everybody's aware and cognizant and there's no crisis and there's no health issues in the way, so that everybody knows, this is what I want. This is what I want the end of my life to look like. Everything we do that we have a target for, whether it's good health, success in our career, achievements, investments, whatever it is, we have to have a target that we're aiming at if we're going to be successful. And we have to be able to measure our way to that target. And it's the same with end of life, ironically. I mean, we're all guaranteed to get there, but how we want to get there, we have to set up that target and say, this is what I want it to look like. What are the steps I need to take to get there? I would say over the course of this year and working with partners in the community, I've learned that I really need to be getting my own ducks in a row. It's time already.
So we know the value of having those conversations early, but also sometimes people struggle to start discussing that with their family about what they'll need or they're going to want. What are some of the things that you found hold people back from starting those conversations? And do you have any advice for, maybe an easy in to begin having those conversations?
I would say fear is the main thing that people, just fear of the unknown. In our area, I would say our patients, maybe the people that are coming onto hospice, they know where they're at and they are on board with everything, and it's their family that's having the hard time. And so we kind of help bridge that gap to get everybody on the same page. So they know what their family member is wanting at end of life.
I would say it's okay to get old. We partner with a lot of meal sites, and they're at senior centers, and so we'll be promoting these meals. Oh yeah, come on down, have lunch with everybody. And we'll have, 80-year-old folks, I'm not old enough for that. I'm not ready to be there. It's like, it's okay. It's okay, it's natural. What I would love to see as part of the opening of that conversation about advanced planning and with the family is just this acknowledgement of the value of our seniors, the value of their experience and their wisdom, and the reality that this season of life has a role in our community, has a place, a true value, a true offering, and to not be afraid of that conversation, to initiate. I like how you put it, Mark, where you said it's an act of love. Yeah, that's a good way to put it, and I'll end it there.
Whereas all of us here at the panel promote the idea of writing down your plans, having multiple plans, multiple what if this happens, this is what I want, this is what I'm planning for. It all begins with conversations, and what we call crucial conversations that can be initiated in families, and different family members may be at different stages. They may want to speak about it, they may be uncomfortable. Sometimes around the holidays, preferably after celebrations, after you've eaten the Thanksgiving turkey, someone in the family could just bring up some basic questions, because we've dealt too many times with people who never wrote anything down, but someone will say, Dad would never want this. Mom always said she wanted this. Do you want burial or cremation? Do you want extraordinary interventions to be kept alive or not? Do you want to be cared for at home or in a small group home or larger facility? Just those questions, basic questions. Even if they don't get written down, hopefully someone will remember what your wishes were.
I have one more question, then I'm going to turn it over to the audience. Whether it's someone talking to their family about their plans for how they want to spend their retirement years and end of life, or a caregiver who is trying to take care of someone in their family, or a loved one of some kind, it can be hard to ask for help. And I can imagine some people out there thinking, yeah, other people should ask for help, but I really don't have that much to deal with. It's not that big of a burden. I don't want to
cause any difficulty for the people around me, what would you say to them?
You're asking how to initiate it? The people in denial?
What would your response be to someone who is hesitant to ask for help?
Oh, to ask for help. Well, if it's government assistance, you tell them that their tax dollars paid for it, so you might as well get some benefit back from it. That usually convinces a lot of people. Yeah, some people, depending on the kind of help you're talking about, some people might be too embarrassed or too, what's the word? Proud, yeah, too proud. I don't need any help. But it improves the quality of life, quite frankly. Interlink is currently embarking on a project, grant funded, where we have someone who goes into the homes of senior citizens and questions them about 35 or 40 questions. And one of them is an open-ended question that says simply, what would make your life better at this stage of life? What could the community do or your family do, or something that would improve your life? Just an open-ended question, because everyone wants to have the best, fullest life they can, even if they are physically disabled or having memory problems. There's nothing wrong with asking, but in that case, nobody's offering anything. It's just a rhetorical question. What do you think would really add enjoyment to your life? And then you go from there.
I think it can be a very sensitive question about whatever it is that is holding somebody back. Sure, shame, pride, but that sense of loss, perhaps, loss of autonomy, identity. And I think approaching that is very similar to approaching other sensitive issues for each of us, and it just starts with listening and empathy and meeting that person where they are. And I think that takes connection and having people in our lives who can do that for us, who can actually listen and understand and meet them there. In some way, be able to say, it's an honor to serve you. It's a gift for you to let me serve you, and for that to connect.
At this time, if we have any audience questions, then I will take those and relay them to our panelists.
Thank you. You were mentioning going from the hospital into a care facility, and I just was wondering, it has to still be a certain kind of facility, and you have to have been in the hospital for 3 days prior to that being the same reason that you're going into the care facility for Medicare to cover it. I was talking to Mark.
That is correct. Yeah, they need a 3-day qualifying stay in the hospital
It's a big
for
deal.
Medicare to pay for a skilled nursing facility.
It's a big deal.
What I've heard, what I know about that subject, and that's for rehabilitation, is it has to be direct from the hospital to the rehab facility, rehab hospital up in Post Falls, or one of the several rehab facilities we have here. You cannot go home for even 1 day. The Medicare coverage then will not apply. It has to be direct, right, from the hospital to the rehab facility, is what I've been told.
That may have changed, but I think that you have 30 days, so if you go home and you fail and you're not able to be there, you can call the doctor and say, I now changed my mind and I would like to go to a facility. Yeah.
There was some discussion about pre-planning, whatever. I've been toying with the notion here, but perhaps you guys know. Is there any, I don't think we have a single source. So if this topic comes up for your family or whatever, there's not a single source of information that can guide you somewhere, is there? In our communities? I mean, someplace you just go and they'd say, well, you could, that has the list of home health care facilities, or I know that I went through this with my mother who had Alzheimer's and got schooled in that, first a rehabilitation, then really to an Alzheimer's unit. But understanding custodial care as opposed to the rehabilitation, that was all news to me. And when you learned it through experience, and it makes perfect sense. So I'm not criticizing anything, but the fact is, you're just really faking it as you go. But it would sure be nice if there was a single source of information, because what I'm seeing now is a ton of tiny nonprofit organizations that are all struggling, and there's no coordination that I know of that really makes any one of them efficient, or where they bind together or should bind together to be helping each other. It should be to me, it should be one community, and I happen to be dealing with senior issues, so areas that seniors can get the help that they need. So is there anything now that we know of?
Are you volunteering, John?
I'm already working pretty hard.
Yes, you are.
But yes, I am.
Yes, I would say definitely come to our office, 124 New 6th Street, right here at Community Action Partnership, the Area Agency on Aging. That is our design and goal. So you can call our office and talk to our information and assistance specialist, who can tell you all about our partners and who we work with and the resources they offer. Our new Elder Resource Coordinator, Susie, who happens to be here in the audience, what we're developing under her role, she provides information about Senior Medicare Patrol and generally what we do at AAA. What we're trying to cultivate in her role as Elder Resource Coordinator is exactly what you're talking about. Somebody you can go to, and eventually we're trying to develop into like a care navigator, somebody who can say, where are you on this journey? And we will understand it. My staff in my office will understand when you tell us your story. Well, oh, we know where you are. Here are the relevant connections. Here are the right next steps. Here are the agencies or the partnerships that our partners that we want to connect you with. That's our goal. That's what we're trying to build. And so I would welcome anybody to give us a call or come into our office, and we will do our best to work with you and get you connected to what you need.
This isn't so much a question as a further comment on that, and that's been my experience. And I'm over in Clarkston, so I get the Washington benefits versus the Idaho. And that's been an interesting discussion in our support groups too, because we've got people from both sides of the river in the support group. But I have been dealing the last 4 years with a dear, dear friend who was diagnosed with dementia and has no family about, and not a particularly good support circle. And 3 of us got together and said, we're going to be his village, which we couldn't have done it alone. I couldn't have done it alone. I already took one partner through 10 years of cancer. I couldn't see myself at my age, because I'm not so young myself, going through any number of unknown years of dementia. Once we got the diagnosis, the only thing I could figure out what to do, and you'll like hearing this, is I went to the phone book and I looked up Council on Aging, because I didn't know what it was called. And I got the Washington version of you in Clarkston. And that's where I started. And what I will say is it wasn't a smooth ride. They didn't have all the answers at the beginning, because each journey is different and different agencies get involved, and it can get really confusing. But what you're talking about is that somebody, at that point, and I think that you have to become more visible. And that person in that role of, what did you say, senior
Elder Resource
elder
Coordinator.
resource coordinator is an extremely important role, and I would be, once I feel a little bit stronger, because my friend is now in an adult care facility, so a lot's been taken off my shoulders, and he now has a guardian that is not me, which is also helpful. But I'd be glad to volunteer my experience, because it was a wild ride getting where we are. And I ended up in the hospital at one point with heart issues. So, you know, these people in here probably know how much it hurts to be caring for somebody in situations where you can't figure out what the next step is. So anyhow, thank you.
Let's connect after this. Come talk with Susie and I. We would love to learn from you and help connect those dots and make those plans.
Even across the river.
Absolutely. Yeah, that is, one of the visions I have is to create a kind of roadmap to aging guide for our area. A resource that's more than just a list of agencies, because we all have Google, but how do we know where to go right now? How did you, whatever you said about the chaos of it, our director likes to say we build the plane as we're flying it. You know, but if you had some kind of guide that could help you say, okay, this is what's going on, what's relevant to this, and get you connected. It's a budding vision, but we're working on it.
Another question. Anybody? How many in this audience know that you're going to die? Okay, that's good. That's good. And then working backwards from there, how many have made end-of-life plans or discussed with your family your wishes? Okay. Well, okay, so we're sort of preaching to the choir a little bit. All right.
We can also take questions from Zoom if anyone watching would like to ask a question. Someone says, how about Walla Walla CNA program? I don't know if any of you know.
Oh, you mean Walla Walla Community College and their certified nurses?
Yeah.
Yeah, they provide, I want to say a 6 or 8 week course for CNAs, but I just know, like, just recently that they haven't had enough students to do the curriculum, so.
How many of you have nieces and nephews who don't have a job?
Yeah.
Yes, this is something that was noted in the documentary as well. And even in Pullman and Moscow, we heard from one organization that basically said they could get paid more with an upcoming warehouse. Right.
Caregiving is an act of love, but you can't eat love. So you still have to pay your bills. That's absolutely true. It's absolutely true. That's at the heart of this. And from the clip you showed, it sounds like this documentary is at least raising the issue and asking questions. Whether or not it has some suggested solutions, I guess we'll have to watch the whole 2 hours.
So my grandmother was lucky enough to be able to plan for and afford long-term health care insurance in her days as a farm wife and on the farm. And that helped a lot later in years when we had to move her into a location she could be cared for. Are there such a thing now, and is there information being shared with the public about that as we plan for retirement and things like that? Do you see people planning for that as well? Because my husband's family had to literally sell the farm to be able to move into assisted living. So it's also a financial burden that people, I find, don't plan for. Do you have advice in that area?
I would say that the amount of people that have like that long-term care insurance is minimal, and then when they want to use it, it's very difficult to get them to pay for what they're needing.
John, you Do you sell long-term, or?
We got out of that market probably 15 to 20 years ago. Basically, that market collapsed, the insurance market for it, and because the policy designs were, first they had a fixed daily rate and that kind of thing, and then costs exploded. So people had old policies that were paying less and less involved with that. And we got out of it because people could no longer afford, frankly, the premiums that it would take to support the eventual costs that are involved. So it's pretty spendy to be in a nursing home. Even locally, my last exposure was $6,000 a month. And I think that's low now, probably closer to seven and a half. So that's a lot of money, hopefully only over a short period of time. But I don't know, Washington State, of course, passed something you're paying into, but is that just just disability coverage, or is that long-term care?
That's kind of long-term care.
Yeah, it is long-term care.
For people who work in Washington and live in Washington, you have to hit both. But from what I understand, when it starts paying out, the lifetime cap isn't really high. It might pay for a year or two of care, not a decade or two. I mean, folks, we're in a different population environment. People living years and years longer than Social Security, Medicare, or private insurances ever anticipated. And that's really at the root of all of this. And so trying to stay as healthy as you can is not just for your own benefit and your family's benefit and finances. It's an act of patriotism, as I said. Seriously, it'll be the difference between Medicare being solvent and Medicare going broke, is if we all try to maintain our health as long as possible.
We're just about out of time. I'm going to give one more reminder, if you haven't yet, to do the survey. We don't have a stick, but we do have a carrot, which is that if you like tote bags, we have tote bags over at that table where you return the survey. Thank you again to the Lewiston Library, our panelists, Mark from Interlink, Todd from the Area Agency on Aging, and Anissa from Elite Home Health and Hospice in Clarkston. The full documentary Caregiving is available on PBS Passport streaming service and will air on TV on June 24th. Thank you and good night.